Hello everyone, welcome back. I hope you are doing good. In this video, I'll be talking about anatomy of liver using pictures only. And in the end, I'll be sharing some clinical notes. So let's get started. So liver is located in the upper right part of abdominal cavity, right under the diaphragm. It extends up to the epigastrium. It is almost entirely covered by the costal cartilages and ribs on their side. So it is the largest gland of the body. It weighs around 1.4 to 1.8 kilogram. It's different in males and females. So during the percussion, the upper border of liver can be percussed at fifth intercostal space. So liver has 5 surfaces: the anterior, the posterior, the superior, inferior, and a right one. And now let's see it in a 3D model. So let's look at this 3D model of liver. As I said that it has 5 surfaces, that is the anterior one, the posterior one, superior, inferior. Inferior is also the visceral surface, and also a right one. This is the right surface. And it also has a sharp inferior border. It has one prominent border, the inferior border. It has 2 notches, the interlobar notch and a cystic notch, the notch for fundus of gallbladder. You can see this is the gallbladder. And the inferior border, it is clinically palpable on a deep inspiration. On deep inspiration, the liver will be pushed down, and the prominent border can be palpated. Let's talk about the ligaments of liver. So the ligaments are basically 2 closely lied folds of peritoneum. You can see this is the 2 folds of peritoneum that are closely lied together, and this will form the ligament. So first of all, let's talk about the falciform ligament. So we have here falciform ligament. It connects the liver to the anterior abdominal wall. Falciform ligament divides the liver into 2 lobes, a left lobe and a right lobe, and you can see the left lobe is comparatively smaller than the right lobe. On the free end of falciform ligament, we have another ligament named ligamentum teres. Ligamentum teres is the remnant of umbilical vein. In fetus, umbilical vein brings oxygenated blood from the navel to the liver. Next ligament, the coronary ligament. Falciform ligament from above, it forms the coronary ligament. You can see right here. So the coronary ligament has an anterior ligament and a posterior ligament. Now you can see on the left part, the left end of coronary ligament, it forms the left triangular ligament, and the right end of coronary ligament, it forms the right triangular ligament. Now, you can see that the anterior and posterior ligament of coronary ligament are quite apart. So this area, it is not attached to the diaphragm. This is called the bare area. You can see an interior border. In this image, you can see this is the anterior part of coronary ligament, and the posterior one would be right here. And this part is your bare area of liver. Now, I also want to show you ligamentum venosum. You can see right here, ligamentum venosum. It is also a remnant of a fetal structure called ductus venosum. In a fetus, the blood would bypass the liver. It would go from portal vein directly to the inferior vena cava through ductus venosus. After birth, it closes and becomes ligamentum venosum. So next we have hepatogastric and hepatoduodenal ligament. So the name itself tells, hepato means liver, gastric means liver. So this is from liver to the lesser curvature of stomach, there is hepatogastric ligament. From liver to the duodenum, there is hepatoduodenal ligament. Together they form the lesser omentum. You can see right here. So hepatoduodenal ligament, another feature I'll tell you later in this video. So surgically, liver can also be divided into 8 segments. You can see right here the division of liver into segments. into segments based upon the distribution of bile ducts and hepatic vessels, and this is the name given. So we have segment 2, 3, 4, 5, 6, 7, and 8. And on the posterior surface, we can find the segment 1 or the caudate lobe. Now, before telling about the relations, I also want to talk about the caudate lobe and the caudate lobe. So in the previous image, I told you that the segment 1, it is different from the left and right lobe. It is seen on the posterior or visceral surface, and it is called the caudate lobe. So caudate lobe can be found here. It is found between fissure of ligamentum venosum on the left and inferior and groove for inferior vena cava on the right. So I told you about ligamentum venosum a few minutes before, that it was from the portal vein up to the inferior vena cava. So we have the fissure of ligamentum venosum on the left and groove of inferior vena cava on the right. This is your caudate lobe. And when we talk about the caudate lobe, it is seen on the inferior surface, mainly on inferior surface of liver. On the left, we have fissure of ligamentum teres. Okay, this was your ligamentum teres, and fossa for gallbladder on the right. This is your caudate lobe. So when we talk about relations, let's go back to this picture. Yeah, we can see we have stomach, esophagus, duodenum. Here you can also see the right kidney. It is more clear in this picture when the liver is removed. You can see there is inferior vena cava. Let's just look at the picture itself. There's inferior vena cava. You can see the right kidney more clearly, and you can also see the suprarenal gland, duodenum, and the stomach and the esophagus. So these are the relations, and we can see the impressions of these organs on the posterior or visceral surface of liver. There's a gastric impression, obviously on the medial side of liver, for fundus of stomach. We have esophageal impression. On more laterally, we have renal impression and therefore suprarenal impression. And below, we have colic impression. Hepatic flexure of colon. There's impression of this flexure on the inferior surface of liver. So this was the colic impression. Next, let's talk about Porta Hepatis. Porta Hepatis is basically the hilum of liver. Through these structures enter the liver. We have, you can see that this is the Porta Hepatis. Here you can see portal vein, hepatic artery, and the common bile duct. Now, if we were to draw it from the shape of liver, you can tell this is your lateral side and this is your medial side. So bile duct is more laterally, and hepatic artery is more medially, and portal vein is posteriorly. So this is the arrangement of vessels or structures in the Porta Hepatis. And yes, and now when a surgeon operates, he does not flip it like so. He has to look at it from inferior surface. So the liver looks like this. Now again, this is your lateral side, this is your medial side. Posteriorly, we have portal vein. Medially, anteriorly, and medially, we have hepatic artery. Anteriorly and laterally, we have the common bile duct. This is your Porta Hepatis. Let's talk about the blood supply of liver. Liver has a dual blood supply. It receives blood from portal vein. Hepatic portal vein collects blood from the gastrointestinal tract, and it directs it towards liver and not directly towards heart. Then it receives oxygenated blood from hepatic artery proper, which arises from the celiac trunk from the abdominal aorta. And then the vein is your hepatic vein. The arrows define the flow of the contents inside these vessels. The blood is obviously coming towards the liver. The bile, which is formed goes away from the liver, and obviously the deoxygenated blood goes away from liver into the hepatic vein. So that was about the gross anatomy. When we look microscopically, the main unit of liver is a hepatic lobule. You can see these hexagonal structures. These are called the lobules. And the connective tissue comes from the Glissen's capsule, the fibrous capsule that covers the liver. So the feature about this hexagonal lobule, you can see that in the center, there is a central vein. This central vein contributes towards the hepatic vein. On the periphery, we can see a portal triad. Portal triad basically contains hepatic artery, the branch of hepatic artery, branch of hepatic vein, and a bile duct. And this arrangement that I told you before, that there is portal vein, bile duct, and hepatic artery, they look like a Mickey Mouse appearance. They give a Mickey Mouse appearance, 3 circles like a face and 2 ears. It gives a Mickey Mouse appearance. So the blood from the portal vein and hepatic artery, you can see it gets mixed up in the sinusoids, and these sinusoids drain into the central vein. And from the central vein, it is carried towards the hepatic vein. So let's draw one lobule, and let's draw 3 of them. Please excuse my drawing. So in the center was the central vein, and on the periphery was your portal triad. So this was your portal triad was on the periphery. So this was your normal classic lobule, the one in yellow. The portal lobule is formed when the central veins are at periphery. The central veins are at periphery, and in the center there is portal triad. So the one in the green, it represents the portal lobule. So we have a classic hepatic lobule and a portal lobule. So last but not the least, clinical notes. So liver biopsy, obviously it is needed for various reasons. What anatomical structure you need to keep in mind while doing the liver biopsies? We do not want to damage the lung. So we ask the patient to hold his or her breath in full expiration. Now when there's fully expirated, when the lungs are fully expirated, the lungs become smaller in size. So there's a decreased risk of damaging the lung. And then the needle is inserted through 8th or 9th intercostal space. And so the biopsy of liver can be taken. Next, there are some recesses formed around the liver. First of all, let's talk about the subphrenic recess. Sub means below, phrenic means diaphragm. So below the diaphragm. So it is between the diaphragm and the anterior superior aspect of the liver. Now it is divided into right and left by the falciform ligament. So it is only a potential space. Normally, the peritoneal surfaces are in contact, but if there is a gas formation or fluid accumulation, it can get accumulated in this space. For example, when there's perforation of gastric ulcer, gas is lighter, so it will ascend upwards, and it can accumulate in this subphrenic space. Next, let's talk about Morrison's pouch, or the right subhepatic or hepatorenal space. So in this, you can see this is the subphrenic space between diaphragm and liver. Subhepatic below, hepatic below the liver, this is your subhepatic, and hepatorenal recess, that is hepatorenal, liver and right kidney, this is a hepatorenal recess. These are all the potential spaces. This is the main part, that it is the deepest part of peritoneal cavity when lying supine. So all the abnormal fluid that is present in the abdominal cavity can accumulate here in the Morrison's pouch. So it is mainly like in ascites, it is seen in the bedridden patients. This is your Morrison's pouch. And that's it for this video, guys. I hope it was helpful for you. If yes, please like, share, and subscribe to our channel.